I'm gathering my supplies, performing hand hygiene, going into the patient's room. Hello, my name is Kyron. I'm a CBCC nursing student, and I'll be here doing a head-to-toe assessment on you. Is that okay?
Okay.
All right. Can you tell me your name and date of birth?
Daryl Edmond, 11/06/95,
Can you tell me where you are?
Columbus, Georgia.
And the current president.
Donald Trump.
Patient is alert and oriented ×3. Do you have any allergies, Mr. Edmond?
No.
All right. Patient seems dressed for the occasion. He's relaxed. Posture is normal and erect. Starting with the head inspection. Head is midline. Skin is appropriate for ethnicity. There are no visible lumps, lesions, or masses. Going to the hair, it is evenly distributed. No lumps, lesions, or masses visibly seen. Palpating through, and I do not feel any lumps, lesions, or masses. Going to the temporal arteries. There are +2 bilaterally. Eyes are bilaterally symmetrical bilaterally, and sclera is white. Conjunctiva is pink and moist. Eyelashes are evenly distributed as well as the eyebrows. I will test for pupillary reaction. All right, pupils are equal in size and they react to light bilaterally. And let's see if they accommodate. Thank you, and then follow. Perfect. I will now feel for nodes. So I have the pre-auricular, post-auricular. I have the occipital, the submandibular, the submental, and the cervical. And there were no palpable swollen nodes over each node. Feeling for sinuses. And there's no swollen sinuses. All right, Mr. Edmond, can I test your nose and your nostril patency?
Yes.
Nose is midline. There's no visible obstructions in either nair. Can I get you to cover one nostril for me and blow out? All right, swap sides. Patient has equal patency in both nostrils. The auricle, lobes, and tragus are all present on each ear. I'll perform a whisper test. Can you cover your right ear for me and tell me what I'm saying?
Basketball.
Swap sides for me.
Soccer.
All right. Patient has equal hearing in both ears. All right. I'll don gloves. Lips are midline and pink, moist. Could you open your mouth for me? All 32 teeth are present, no dental caries noted. Open again for me. Hard and soft palates are intact and moist. Buccal mucosa is pink and moist. Say ah. Uvula is midline and rises. Tonsils are pink and moist with no exudate present. Can you lift your tongue up for me? Down, side, side. Can you close your mouth and blow out your cheeks? Alright, smile, frown, frown. Raise your eyebrows. Alright. Cranial nerves 3, 4, 6, 5, and 7 are intact. Neck is, say ah.
Ah.
Gag reflex is present. Alright. Neck is midline. Trachea is midline. Skin color is appropriate for ethnicity. Alright, Mr. Edmond, can I get you to swallow for me? Alright. Thyroid gland is not swollen and the trachea is fine too. Assessing the anterior test, the skin is appropriate for ethnicity. There are no visible lesions or masses. I'll auscultate. There are no wheezing or crackling present. Chest is rising and falling symmetrically. I'll check for heart sounds, starting with the right side, second intercostal space. Aortic, pulmonic, herbs, tricuspid, and mitral. I'll go to the back and inspect the patient's posterior chest. Can you lean forward a little bit for me and relax your hands down by your side? Can you breathe normally for me? Deep breath in, deep breath out. Okay. I'll listen, auscultate the posterior chest. Just breathe normally for me. There's no excessive accessory muscles being used on neither the anterior or posterior chest when breathing. Alright, Mr. Edmond, can I get you to squeeze my hand? Can you pull? Let me push. Perfect. Can you rotate your wrist for me? Hold your hands out. Supinate. Pronate. Around for me. Patient has full range of motion in upper extremities. Can I see? Okay, relax. Can I feel your fingers? Skin is appropriate for ethnicity. Skin is warm, dry, and intact. Capillary refill is less than 2 seconds. Can you push against my head? The other one. Alright, and turn left, right, rotate. Cranial nerves 9 and 10 are intact. Alright, can I get you to lay down for me?
Which one?
Right here, just anyway. on your back. Lay down on your back. Alright, I'm going to perform a breast exam. Can you hold this arm up over your head for me? Skin is appropriate for ethnicity. There's no visible lumps, lesions, or mass. And then I'll begin palpating, starting in the armpit, going down to the breast. And then I'll squeeze the nipple. There are no palpable masses, lumps, or lesions in the breast or armpit, and no exudate from the nipple. Going to the abdomen. Skin color is appropriate for ethnicity. There are no distension, lumps, lesions, or masses. Auscultate. Starting in the right lower quadrant, right upper, left upper, left lower. Bowel sounds were present in all 4 quadrants. You can relax your arm. Now our percuss. Tympany was heard with dullness over organs, and now I'll palpate. No pain or tenderness reported in the abdomen. No lumps, lesions, or masses were palpable. Checking the JVD, no JVD noted, and then I will palpate and auscultate the carotid arteries. One at a time. +2. Carotid pulse was +2 bilaterally. And now I'll feel the femoral artery +2. Growing is appropriate skin. Growing skin color is appropriate for ethnicity. Hair is evenly distributed. Penis is circumcised. Scrotum and perineal area has no visible lumps, lesions, or masses. His skin is warm, dry, and intact. Can I get you to rotate, turning that way for me? Okay, when was your last bowel movement?
Earlier today.
Alright, and rectum is intact. Turn over for me. Alright, can I get you to push your knee up for me? Alright, relax this knee up for me. Relax. I'll feel the popliteal arteries. +2 bilaterally. The posterior tibial. +2 bilaterally. Dorsalis pedis. +2 bilaterally. And the capillary refill was less than 2 seconds in the lower extremities. Can you sit up for me? And now I'll feel your brachial pulses. +2 bilaterally, and the radiolar +2 bilaterally as well. Can you push your feet against me? Alright, perfect. Patient has full range of motion and good muscle strength bilaterally and lower extremities. Stand up for me. Can I get you to walk towards me? Thank you. And tandem walk back that way with heel to toe. Turn around. Heel to toe. Alright, patient has a nice and steady gait.